Hi, welcome to Fast Intelligent Care. In today's episode, I will be talking about how to assess the effectiveness of single-handed care. So looking at outcome measures that are going to tell you if single-handed care should be implemented. So once you've decided that your client is suitable for single-handed care, you'll do a short trial where you will now start implementing your single-handed care methods. So you'll have your one handler using equipment and specific techniques to make single-handed care possible. And then we have tools like the Borg perceived exertion scale, the rapid entire body assessment, and then also other record keeping to help determine if it is actually something that should be implemented on a permanent basis. The Borg scale measures how physically demanding a manual handling task feels, so it's perceived exertion. So there's a scale that is going from 0 to 10, so it's either let's say 0 no effort or 10 maximal effort. So lower score, less effort, higher score, more effort. So the suggested way to implement it is to look at how are the carers performing the tasks currently, rate the amount of effort that they are exerting with the current method, so the non-single-handed care method, then do the same, let them do the proposed single-handed care method and then redo the rating. And then you can kind of compare the two scales and look if there's actually a meaningful improvement in how much strain they're actually having to exert. So let's say the initial method is having 2 people do it. The single-handed care method is having 1 person using equipment instead of having 2 people. And then if you do see that there's actually improvement in how much effort it requires, you know that's going to be a better option. Then we have the REBA, so REBA. This is the Rapid Entire Body Assessment. It's a validated assessment tool and it looks at musculoskeletal risk during manual handling. So it looks at things like trunk posture, neck posture, load and force, grip, movement, repetition, and task difficulty. So the reason REBA would be useful for single-handed care assessment is it identifies any high-risk posture patterns. It demonstrates safer techniques when equipment is being introduced, and it can objectively show improvement after single-handed care changes. And it will help justify those care plans. Then some other useful outcome measures that you could look at, other than the Borg and the REBA, could be looking at how much time something takes, so the task duration to complete the task. So are we actually being more efficient by having just 1 person, or is it the task now significantly taking a lot longer by just having 1 person doing it? Then we could look at the carer's confidence rating. So this could also be from a scale 0 to 10. Are they feeling more confident with the single-handed care methods, or is their confidence rating significantly lower? Then we're looking at client comfort and how the client feels about the method, if they feel safe, if they feel comfortable. And we also want to look at maybe how many steps are now required in this task, or how many times the person needs to be repositioned or repositioning attempts. And we also want to make sure that we are keeping record of any near misses, any accidents, any incidents, so that if we do want to be doing single-handed care, we need to make sure that it is still safe. So if there are a increase in accidents or near misses, we know that it won't be safe to implement. So this is all part of our risk assessment as well. And then looking at our client's anxiety level as well. So looking at if they are becoming more anxious with having just the 1 person versus having 2 people. And then we also want to make sure that we keep record of all staff that are trained, so that if there is a number of staff that are assisting this client, that everyone is trained in single-handed care and everyone's confident. And we also want to make sure that all of that is documented properly, so that we don't have the risk of maybe just a few understanding the single-handed care methods, and then a few staff that are potentially not confident to implement those methods. Okay, so what does single-handed care success look like? So I would say a successful single-handed care trial would be having reduced strain on carers, having predictable, stable movements for the client, having no incidents, no near misses, having the right amount of equipment or the appropriate equipment that reduces effort, and then having the environment support a safe one-person or single-handed care. So making sure that the environment is also set up. So if the environment needs to be set up in a specific way for single-handed care to be successful, that should also be documented. And then also if the client reports being safe, feeling safe, comfortable, and improved dignity and confidence, or improved independence, then we know that single-handed care was successful or the trial was successful. So now let's look at how to review our single-handed care trial. So compare your pre and post Borg scores, compare your pre and post REBA scores, observe movement quality with the one-handed care or one handler, observe or evaluate the environmental fit, so look at space, flooring, layout, confirm equipment suitability, get feedback from the clients and the carers, check for any safety concerns or workflow inefficiencies, and look at the confidence and comfort of carer and client. Once we've done our single-handed care trial, determined positive outcomes, we can now successfully implement single-handed care. Let us know in the comments if you've had any experience with using the REBA or Borg perceived exertion scale, and if you've done any reviews of your single-handed care trials. We'd love to know how you found them, were there any tools that you found helpful or any specific feedback that was valuable. We would love to hear from you, and stay tuned for our next episode where we will talk about how to choose between a gantry, ceiling hoist or a floor hoist.